Good afternoon to all. Today's topic galvanic type current. First definition. What is the galvanic type current? It is a direct current. Galvanic current is a direct current. Undirectional. It is a very painful to patient because it is a undirectional. To the overcome this regular pause can be given between stimulation. Interrupted galvanic current, that means IGC. Constant direct current is used for iontophoresis. IGC, that means the interrupted galvanic current, is used for denervated muscle stimulation. It is a direct current used to activate muscles directly without activation of a peripheral nerve. Direct muscle stimulation requires pulse or phase duration of at least 1 millisecond and more often uses even longer duration. Doses a regular 20 to 30 contraction with an average of 90 to 200 contraction per muscle per day. Case being a motor point response to Faraday current. It is a direct current. Evidence for appropriate electrical stimulation can cause denervated muscles to contract. Contraction of denervated muscles maybe helps limit edema and venous static within the muscle and therefore delay muscle fibers degenerations and fibrosis. Recovery the time flowing denervation appears to be shortened with appropriate electrical stimulation. Evidence against contraction of denervated muscles may disrupt degenerating neuromuscular junctions and subsequently delay reinnervation. Denervated muscles form a sensitivity trauma then evidence against the contractions of the denervated muscles may disrupt it regarding a neuromuscular junction, a subsequently delay of regeneration. Denervated muscles is more sensitivity of trauma than innervated muscles and electrical stimulation more further traumatize the denervated muscles. Prolonged electrical stimulation until reinnervation occurs is worth the financial and time cost involved. Unipolar versus bipolar motor point stimulation. What is unipolar motor and bipolar? So electrode used unipolar motor point stimulation. One small activate electrode and one large precise electrode. Electrode used a bipolar motor point stimulation equal sized electrode site of stimulation. So unipolar motor point for a stronger response and bipolar motor used effect depends on placement. Descriptions. Same amount of current passes through the each electrode. Smaller size electrode will have a higher current density that is higher the stronger electrodes. Equally small electrodes used for the stimulating denervated. Next. Comparison of electrical stability of nerve and muscles. Nerve, this is muscles. Resting membrane potentials -70, -90 MB. Accommodation rate higher and muscles accommodation rate is lower. Pulse duration used for stimulation. Shorter pulse duration. This is longer pulse duration. Intensity need for stimulation. Higher intensity since pulse duration is short. Lower intensity since pulse duration is longer. Stimulation of innervated versus denervated muscles. Type of contraction, innervated and denervated. So type of contraction 1 by second, a single brisk contraction. Denervated sluggish. Rate of change of current, sudden increase the intensity or gradual rise in intensity. Strength of contraction depends on number of motor unit activate, depends on a number of muscles fiber activate. Intensity higher and this is lower. Pulse duration less the 10 millisecond short pulse duration and this is denervated more than 10 millisecond longer pulse duration. Chronix, this is 1 millisecond is 15 second. Ideal current, periodic on periodic type, and this is interrupted direct current. Uses first, constant direct current are used for iontophoresis. Again, modified direct current are the used to stimulated denervated muscles. Maintain the properties of muscles, retards the denervation atrophy. Helps the muscle utilize all the substances and maintain nutrition, improve absorption and activate pumping functions of the muscles, prevent venous and lymphatic static, maintain the working hypopexy and denervated muscles, maintain the extensibility of the muscle, improve for local circulation, prevents the contracture, stimulating denervated muscle. Electrical current may be used to produce a muscle contraction in the denervated muscle. Denervated muscles has lost a peripheral nerve supply. Purpose for electrically stimulating denervated muscle is to help minimize the extent of atrophy while the nerve is regenerating. Stimulating denervated muscle. Muscles fiber extends denervated in size, diameter and weight of individual muscles fiber. There is a decrease in amount of tension which can be regenerate and the increase in the time required for contraction. Degenerative changes progress until muscle is re-innervated by axons regenerating across site of lesion. If re-innervation does not occur within 2 years, fibrous connective tissue replaces contractile elements and recovery of muscle function is not possible. Muscle stimulation with interrupted direct current. The term muscle stimulation is used to refer the production of a contraction in a muscles or muscles group by application of an electrical stimulus. The objective is to assess the responses of electrical stimulation of the peripheral motor neurons and the muscle mutation. Depending on the nature of the contraction that produced by a mean direct current, pulses distinctions are made between the single or multiple stimulation. In single stimulation, a single contraction is produced. Multiple stimulation leads to tetanic contraction. With respect to the pulse type of current, only rectangular and triangular pulse interrupted muscle stimulation. Application of the galvanic current. What is that? The application of the galvanic current? Show denervated muscles, facial muscles weakness, secondary of to Bell's palsy and facial palsy, and to forest. Why galvanic over the paralytic in facial muscles? So, motor point of facial nerve. What is that? Temporal, frontalis, obliquus oculi, and coriolis suprapiculi. Zygomatic vesicles, mandible branch. This is the temporal. Here is the zygomatic in vessels, and this is the mandibular branch. This is called the facial nerve. show the expression, the facial nerves. Motor point of facial nerves. This is the frontalis, foveolator, orbitator oculi, orbitoris. This is lower lip. This is facial nerve trunk. This is facial nerves of the lower branch. This is facial nerves, middle branch. Facial nerves, upper branch. What is the contraindications of the galvanic current to mainly placement of electrode, tense tendons on the part heart, presence of cardiac pacemaker, presence of the malignancy, placement of electrode along regions of phrenic nerve, placement electronic over the carotid sinus or the laryngeal musculatures enhanced at L. The indicates of the NME as contraindicated anywhere or a pregnant woman. However, there appear to be evidence for this. Precaution. What is the precautions? Mainly precautions. Adequate precautions should be taken for a patient with the heart problems. Placement of electrodes across the heart transhorically can cause arrhythmia. The device should not be used in skin eruptions or swollen, infected, and inflamed areas. Turn the unit of the unit applying the removing electrodes. Do not use over the eyelids. Danger. Edema, burns, electric shock, and hypovolemic shock. Thank you so much.